We have talked rhetorically about meeting their needs as it relates to providing psychological first aid by extending our hand of appreciation, a good word, kind of support that we all need, a little bit of moral support. But we need to do more than that and provide the kind of support that increasingly is needed for a workforce that is deeply stressed out, deeply stretched. Families that have been broken apart because their loved ones are spending 24 hours a day, 7 days a week, attending to the needs of others and not able to come back home, in many cases sleeping in their cars overnight. In other cases, unwilling because they've been exposed to this virus to even want to expose their family back at home and are spending their own money to go to a motel or a hotel overnight. We've heard countless examples of these stories. And instead of continuing to absorb those stories, we wanted to do something more and do something better. And so I'm really pleased today to announce an effort in the state of California to directly support those caregivers, those healthcare workers, those frontline heroes, by providing them vouchers and stipends, and in many cases for low-wage workers, 100% reimbursable costs at hotels all up and down the state of California. We currently have in inventory over 150 hotels that have been part of a bulk purchasing of room program through our Department of General Services. Some of the nicest and finest hotel chains in the world are participating in this program, providing deep discounts to the state of California. And we will extend those deep discounts directly to our caregivers. And in other cases, again, for low-income workers, we'll provide 100% reimbursements so that they're allowed to stay closer to their patients and provide them the opportunity not to worry about being out of pocket or worry about exposing their families or, God forbid, worried about another night sleeping in their car so they can stay closer to the needs in their communities. Let's remember, people are commuting for an hour, hour and a half in the good days. And the idea that you're doing a 12-hour shift and at 2, 3 in the morning have to drive all the way back home only to get right back up and do a double shift early in the morning, that's not appropriate and that's not right. We need to do better for these workers. And so I'm very pleased that we have put together a new website, Cal Travel Shop, or rather caltravelstore.com. caltravelstore.com is the site that will have the list of these 150 plus hotels. Every day we're getting more hotels to participate in this and make available these vouchers for those individuals. Lower wage workers, richer supports, the higher wage workers, deep discounts across the panoply of our healthcare workforce. I want to also thank the airlines that have also stepped up. United Airlines, they reached out to us and they said, you know what? We read about the Health Corps website that you put together, all now 86,516 individuals strong. 86,516 individuals have signed up on our healthcare site. And United Airlines called and said, if you have folks that are traveling into the state that want to be part of that Health Corps, we want to take care of their travel costs. 100% round-trip tickets, no matter where they are at any point of the globe, not just across the United States or within the state of California. And I just want to thank United Airlines for stepping in a big way to help that workforce address the other anxiety, which are travel costs, not just accommodation costs, hotel costs. No sooner, by the way, did United reached out, then we got a call from Southwest Airlines, Alaska Airlines, and Delta. Those are the 4 airlines that met this moment. And let me thank not just United, but once again, Southwest. Let me thank Alaska Airlines and thank Delta for committing to do exactly the same. And so that information is also available at our website, and we couldn't be more grateful for their largesse and their support. And by the way, that's an open-ended commitment until this crisis passes, and our commitment to the accommodations and hotels extend accordingly. So more care for our heroes, for our caregivers at a time when we need to be there for them so that they can attend and focus on the needs of the most vulnerable patients throughout the state of California. And also, I should just extend those that are in the workforce that may have been impacted and tested positive, healthcare workers, for COVID-19. We also are providing these sites, these hotel rooms, as isolation rooms, as quarantines for those individuals as well. And those that have also been exposed and are worried about their health and their process of getting back results in their tests, that can't go to work until those test results come back. These are also hotel rooms that are set aside for you. And so I just want to thank all our partners in that endeavor, and also all the individuals. We did one of those Zoom calls about 10 days ago, and universally, this was the #1 ask for the people that participated in that call. And these were representatives of our doctors, the California Medical Association, our Nurses Association, Bonnie and her team, April, SCIU, and Bob, and Dave Regan, and others that all participated in that. And they said this was one of the top asks of their members and one of the most important things we can do to help with their stress and ease their anxiety, also their financial burden at this time of crisis. So that's the announcement we wanted to make up front. In addition to that, I want to just extend a few updates in terms of data and new information that's come in, as we do on a daily basis, in terms of the total number of individuals impacted and currently testing positive for COVID-19. 18,309 is the official state count of those that have tested positive. 492 families torn apart. These are not statistics. Behind every stat is a real person, real lives that have been torn apart. 492 lives lost now in the state of California, 50 other families torn asunder yesterday that lost their lives over the course of the last 24 hours to this virus. 1,132 individuals are in our ICUs, and 2,825 are now hospitalized in the system. Let me just put that into statistical terms in terms of percentage increase. The 2,825, the total number of hospitalized, is roughly 4.1% increase from yesterday. And here, very importantly, is a statistic in terms of percentage drop that I haven't been able to communicate in any of my daily briefings, and that is the total number of individuals in the ICU. That number of 1,132 represents a drop of 1.9% from yesterday. One data point is not a trend. One data point is not a headline. So I caution anybody to read too much into that one point of data. But nonetheless, it is encouraging, and it just again reinforces the incredible work that all of you are doing to practice physical distancing. The stay-at-home is working in the state of California. That curve, it has been bent in this state, but it's also again been stretched. And we continue to be vigilant and do more every moment of every day to procure the physical assets in terms of alternative care sites, as well as the appropriate levels of PPE. We made a significant announcement about that last night, and that includes ventilators that we confidently have secured within the hospital system and on our own state cash to meet the needs based upon our models and projections. And on that front, let me just reinforce a number that I gave a week or so ago. Well, let me go back. About a month ago, I reminded all of you that we had 7,587 ventilators that were identified within our 416 hospitals. That was the number that we advanced in the beginning of this curve. We said that the hospitals, like the state, were going to do everything they can to procure even more ventilators, refurbish ventilators, get supplies donated, and the like. Just a week ago, I announced that they had done just that. No longer 7,587, that the hospitals had 11,063 ventilators, which was good news. Today, because the hospitals every day are doing everything they can, like the state of California, to procure more ventilators, today they have 11,747 ventilators. I make that point to make this point. I think some people have expressed some concern about California's willingness to extend a hand to New Jersey, New York, Illinois, D.C., to Maryland, to Nevada, and to other states across this country by lending ventilators to deal with the crisis at hand in those states. We felt it was the right thing to do, but I also want you to know it was the responsible thing to do as American citizens, from a moral and an ethical imperative to save lives, all of us Americans, but also responsible in this context. The hospital system alone is currently utilizing 31.89% of all their ventilators. Forgive me for the precision, but I think you deserve precision. 31.89% of those ventilators are currently being used, which means over 8,000 ventilators are not being used within our hospital system. That does not include the number of ventilators the state of California has in its storage facilities and the number of ventilators we have been sending out over the course of the last number of months. So I just want to secure any anxiety that people have and also remind you of this. Ventilators are different than personal protective gear. They're consumed personal protective gear, and they are destroyed, with, again, the exception of N95 masks, which we are now able to reuse because of the new Battelle system that we have procured that will be operational by April 20th of this month. But ventilators can be used over and over and over again. And when those ventilators are used to save lives in those other states, we have the firm commitment from those states to send them back to the state of California. And why? Because, again, our curve is not bending like other states. We have stretched our curve, giving us a little bit more time. But we can't just sit on assets when we can save lives and help our fellow Americans. And so I just want to clear up any anxiety in that space or any ambiguity or any misinformation, to be candid with you, that's been expressed in this space. I am not, though, naive on this front, that we live in the aggregate. I give you those numbers, and that does not necessarily reflect the reality in each and every county in the state of California. But within the hospital system themselves, they have a remarkable mutual support program and strategy. In the state of California, led by David Duncan, is responsible for our state's effort. They check in every single day to all the county health directors to check in on their current supplies, current need. And our ongoing resolve is each county should at least have 2 times as many vents as they need on any given basis, on the basis of how we then procure and process the redistribution or distribution of those assets.